weekend, and we're asking everybody 60 plus to get registered in the Get Vaccinated campaign.
And just quickly on that issue before we move to the questions, no rush for someone that's 60 or 61 to call in and try to book an appointment. They are not eligible to book yet. They are to register, and the sense is that over the next few weeks, they will be notified that it's their turn to book. Like, is that so? By mid to early May for the 60 plus group, is that the sort of target timeline?
It takes about a minute or two, and we're encouraging everyone to get registered. It helps us as we organize, of course, and it will help you get access and know as soon as possible and be registered in the system so you're ready to get a note. Just to give you an example, last week, I think it was last Wednesday, we moved to the 65 plus, and already everybody 67 and over has received their invitation to book. So you want to get in ahead. Right now, if you're 60 or 61 or 62 or 63 or 64, that you get registered either by phone or preferably online. We've got massive capacity online to take charge of that. It's been going very well. I think to date, just to put it in context, about 650,000 British Columbians have registered, and that number is growing every day, and we want to really encourage everyone from 60 who's age 60 to 64, which is a big age cohort in BC, as you'll know, Richard, to get registered today.
Okay, do we know that number, Adrian? How many people in that cohort? Hundreds of thousands, for sure.
Yeah, absolutely, hundreds of thousands. In the 55 to 64 age cohort, which has been open now, and people are getting Astrazeneca right now as we speak at pharmacies around BC, and they can book their appointment by going through either through the BC CDC or the BC Pharmacy Association website, finding a pharmacy and get their AstraZeneca shot right now. We know that we've sent out well over 100,000 doses now to pharmacies around BC, and they're probably in those cohorts about 600 to 700,000 people. So these are large cohorts of people between 55 and 64. So this is a large cohort. Just to put it in context, over 90, there are about 50,000 people. More than 47,000 of them, just around 50,000, 47,000 of them have been vaccinated. In the 75 to 79, around 73,000 people, it's about 66,000 vaccinated. So those categories are pretty close to completion, really over 80. A majority of people over 65 have already been vaccinated, and we're moving towards those goals every day. So our Get Vaccinated, our primary age-based campaign is moving along, and we really need people to get registered. This allows us to plan and make sure that everyone gets their vaccine when they need it. In addition, 150,000 clinically vulnerable people are part of that Pfizer and Moderna campaign, that effort, and that group is overwhelmingly getting vaccinated.
All right, so I'm going to try to make it easy for everyone following along, and I'll mention whose questions these are so that when you hear your name, you know these are your questions. I will also send an email to everyone with the order in which I ask the questions to make it a bit easier to go through. So this is from Alyssa at CTV. We currently have 2 outbreaks in long-term care, one in Langley and one in Chilliwack. How are outbreaks in long-term care still happening?
So we have outbreaks. I think one of the outbreaks she's referring to is an assisted living outbreak. But in seniors care in general, there's long-term care, there's assisted living, there's independent living. We have an outbreak, as you'll know, as people will know, at the Cottonwoods in Kelowna. We have a small outbreak, I think, of 2 staff people at Acropolis Manor in Prince Rupert. And we have a couple more. And really very few outbreaks are happening in BC. You'll recall there were 49 outbreaks in all categories on January 15th. And right now there's, less than a full handful of outbreaks. It is the case, first of all, that these vaccines are more than, when we refer to them as more than 90% effective, that doesn't mean they're 100%. It means in some cases, there may be people who are not vaccinated, but what we know is that in our current outbreaks, I think we have one case of someone who's passed away with COVID-19 in the current outbreaks. So the vaccines have had an enormous effect in making life safer in long-term care. It is possible there'll still be people who get sick in long-term care. And our standard in long-term care is to declare an outbreak when people get sick in long-term care. That is a safety protocol, and that's intended to keep the whole community safer. But about 40,000 workers in long-term care have been vaccinated, well over 30,000 residents. The vast majority of residents, and by vast majority I mean 97% have been vaccinated. So yes, there's still going to be some outbreaks, but those are dramatically less severe, and there are very few of them. But it doesn't mean there are none. There's a lot of community transmission, and there may be some people who are either not vaccinated or who get a case of COVID-19 in spite of being vaccinated.
Would you describe these as concerning? The small number of outbreaks that are happening in care and assisted living?
Every outbreak is concerning. Every single one is concerning to me. But I think what we've seen is really overall the development of community immunity in long-term care, with this vast majority, this over 90% of people vaccinated. That doesn't mean, and that never meant there would be no cases, but what it means is that overwhelmingly people are safe in long-term care. But of course we're concerned every time there's an outbreak. We had in Prince Rupert, referring to Acropolis Manor, we had a very significant amount of community transmission in the hundreds of cases in weeks, just a few weeks ago. And those number of cases has dropped considerably in the whole community. But that doesn't mean there wasn't a lot of community transmission at that time. And this is, I think, also, I would say, a warning for everybody, that when you get vaccinated, the full effect of the first dose is not in place for 21 days. So this is not a case of getting vaccinated and thinking you can do things you couldn't do before. You absolutely can't. It's critical to be safe. But what it does every day is make you safer, and by extension, everybody else.
I'm sure you are aware that there have been some rumors circulating online about some sort of business lockdown coming in British Columbia on Monday. Should British Columbians expect to hear news on Monday of more extensive orders and restrictions around locking down, especially when it comes to businesses?
No.
Thank you. Next question. Mary Cranston would like to know, it's been almost 2 weeks since BC paused the distribution of Astrazeneca to those 55 and under. Bonnie Henry said we would have information within the next few days. We haven't heard anything. Is the program still temporarily paused? When should we expect to hear more from NACI and the federal government?
Well, the program is paused, and it continues to be paused. We would expect to hear more information this coming week. We have heard the response of in the United Kingdom by public health authorities there and by the European Medicines Agency in their analysis. There's still work to be done in Canada, and so to assess the safety signals, and that work is ongoing. But in the meantime, of course, we've distributed well over 100,000 doses addressing the 55 to 64 cohort through the BC Pharmacy Association and the network of pharmacies across BC. So we didn't let that slow down our efforts. Obviously, a lot of people who were expecting, because of their employment, to get vaccinated with AstraZeneca, that's been deferred. But we made the decision that we needed to keep going to absolutely use the AstraZeneca we had, these extraordinary vaccines that we have, to use them as widely in the population as we can, and that's what we've done. We should expect more. Obviously, we would have preferred to continue on the path that we were on, but we pivoted when things change, and the result is tens of thousands of people already vaccinated with AstraZeneca in the 55 to 64 age cohort, and of course many of those are workers.
Should we expect more details this week around vaccinating essential workers in outbreak areas? Firefighters in Surrey, you know the list. Is this something that we are working with Pfizer and Moderna at this point?
Absolutely. So we're setting aside, and I think Dr. Henry made it clear, and we did in our original in our strategy that we laid out in detail a few weeks ago, that we're setting aside for outbreaks a certain amount of Pfizer and Moderna. And the places where we're seeing the highest level of transmission right now are in Fraser Health and in Vancouver Coastal Health, although not only there. And so we're going to be using those to deal with specific outbreaks, strategically to deal with specific outbreaks. Our main use of Pfizer and Moderna continues to be our age-based campaign for all Indigenous people, of course, as well, and for the clinically vulnerable. But we're setting aside a portion of that to help us fight outbreaks in communities, and that work is happening. That immunization is happening now, and you'll be, of course, hearing more about that in the days to come. And it's part of the effort to give public health the resources it needs to try and save lives, limit pressure on hospitalization, and of course reduce transmission in communities.
A few different vaccination questions here from different outlets. So I'll go to the CBC questions on vaccination. And similar to what I just asked, but more specific to teachers, as you know, the teachers in Fraser Health, all of them have been calling for vaccination. You know, where are we at with, is that potentially something that we could see before we get on track with Astrazeneca or Janssen and with Janssen vaccine, that we could see Moderna or Pfizer be used, for example, for all teachers in a health authority?
So you'll understand that we've used Pfizer and Moderna strategically up to now. You'll recall the 9,003 people that were immunized in Prince Rupert. I think the 10,000 education workers, not just teachers, but teachers' assistants and education workers, immunized in School District 36 in Surrey, and that was half of that was AstraZeneca, and about half of that was Pfizer in that case, Pfizer or Moderna in that case. And so we are strategically using those some Pfizer and some Moderna to address outbreaks. This is not a replacement, though, for the sector or the vulnerable worker effort that we had proposed, which obviously was suspended when we got a change of use on AstraZeneca. But you will see us focused on outbreaks in particular communities. And that's already happened for education workers in Surrey. It's happened in Prince Rupert. It's happened in a whole variety of other communities. It's happened with respect, especially with people in food production and food processing. And that will continue as an additional tool for public health to deal with outbreaks. So that may affect some of the communities of workers, types of workers you talk about, but it's going to be used by public health to deal with outbreaks as they occur. We're not shifting away from the most vulnerable people getting immunized first in our age-based and clinically vulnerable program, but we are creating some ability of public health to use the vaccines we have effectively.
CBC has spoken to someone who is a parent of a child with a development disability. They say they're having challenges securing vaccine appointments despite being eligible. What type of demand has the province been seeing in terms of this cohort? And have you heard about these problems securing the vaccine?
Sorry, excuse me, Richard, can you just tell me the circumstances? Because obviously we're not vaccinating children at this point.
No, so we've been hearing from parents who have kids with development disabilities. I've looked at that list. I didn't know that they were. I didn't know myself if they were eligible for the vaccine. You obviously would know better than me. But the question verbatim, all I have here, Adrian, on this is, we've been hearing from parents who have kids with developmental disabilities having challenges securing vaccine appointments despite being eligible. So I assume these parents believe they are eligible because their children are either immunocompromised or have development disabilities. And they are just wondering if you've seen a high demand in this and what, whether you've heard about this demographic being a challenge or whether they are even eligible. I don't know.
That's right. I think it's people who are clinically vulnerable who are eligible, and that includes adults with developmental disabilities. Obviously, children with developmental disabilities are not eligible because these vaccines aren't licensed for children yet. They may be at some point in the future, but they're not as of now. So if CBC could forward to me the specific circumstance, I can take a look. But I would say, but I just want to be clear that it's people like, we've had, for example, a number of people say, my partner or the person I take care of is clinically vulnerable. and who would like to be vaccinated at the same time. And it's the people who are clinically vulnerable who are vaccinating at this time because we have the vaccine that we have. And so that may be the circumstance here, but we want to answer these questions really precisely, so I'd encourage CBC to send me the question and I'll get them the answer.
Yeah, and I'm sorry about that, because that's one of the challenges of doing this consortium. Because
it's no problem, but sure. Because the people involved are dealing with tons of issues as well, we really want to be precise about their circumstances.
Yes.
But I would say, let me just give you an example though. So adults with developmental disabilities are eligible, right, in the general sense, and they're on the list of clinically vulnerable, and they've been getting letters, and we've seen a really remarkable uptake in that group for obvious reasons. Many people who are clinically vulnerable have been self-isolating to an extent that most of us haven't been self-isolating over the last year. So it's understandable that that would be the case. But many adults with developmental disabilities live with their families, continue to live with their families, as you know. And often they're self-advocates, and others obviously live in other circumstances, in congregate living, and so on. But if, for example, the parent of an adult child with developmental disabilities, whose adult child was eligible to get the vaccine, that adult child would be eligible, but the parent would be waiting for their age cohort. Now, people in that circumstance, because the age cohorts are coming down, are increasingly able to get vaccinated as well in their age cohorts. And some of these questions will be addressed as we move forward. We're now registering people 60 plus today, and that's partly because of good news, that we're increasingly confident in our expectations around supply in the coming weeks. That doesn't mean we're getting what we need, but that the federal government is increasingly clear that they're able to deliver what they've promised to deliver. So that is more next week than the following week, and it goes up and down, but that's why we're advancing registration to people 60 plus.
More broadly on vaccine, you spoke this week about the unpredictability of vaccine shipments. How challenging has that been for the province to keep up with the consistency of appointments? And is the goal still to have everyone who's eligible vaccinated at least once by the end of June?
Yeah, everyone who's eligible have the opportunity to be vaccinated, of course. I mean, some people may not be vaccinated, but I think an overwhelming majority of people want to, and we're going to spend much of the next few months convincing the remainder that it's a very, very, very strong and important idea for them and everybody else. So we're absolutely on track to do that. I mean, often we get federal announcements, you hear them where they're adding vaccine frequently, that's for June. And so we're pretty confident of what's coming ahead in the coming weeks in terms of the amount of vaccine as well. So there has been a lot of uncertainty around the days that Moderna arrives, for example. Pfizer's been pretty regular in the process. So the Moderna that was supposed to arrive the week of March 22nd to 26th arrived, all of it. That amount of Moderna arrived last Wednesday, the final amount of it. It arrived in dribs and drabs through that period. And that's a challenge because we have to be cautious in organizing clinics to make sure we have vaccine on hand. And at the end of every week, not at the beginning when the vaccine arrives, but at the end, we've run through a lot of our vaccine, our Pfizer and Moderna. So we want to get the vaccine in people's arms as soon as possible. And when you're not certain about when it's coming in, that makes it really difficult because these are individual actions, right? The immunization happens with an individual provider and an individual person getting the vaccine. And so all of that requires the vaccine to be there at the same time. And obviously it causes problems when there's delays. But that said, the response, the 650,000 people who've registered, the record number of vaccines that are going to be delivered, I think, every day in the coming week. I think we're going to be north of 50,000 when we get into next week with the distribution of Astrazeneca to pharmacies around the province. We're going to be vaccinating a lot of people and making real progress. And of course, if we had more vaccine, we could make even more progress. But we're trying to deal with what we have and not what we'd like.
I'm sure you've heard of this case at a Save-On, and I think in Burnaby, where up to 10 people were given expired doses of Astrazeneca. How does something like that happen? Does it concern you? And is there a guarantee to people that something like this won't happen again?
Well, I don't think you can absolutely guarantee that something won't happen again. It was clearly a mistake. It was a mistake made at a location, and obviously all the people have been contacted and told both what they need to watch for and be prepared for, and obviously they would all be eligible to be immunized again as well. So we don't want that to happen. I think it involved 10 people. It was unfortunate, and lots of steps are taken on a regular basis to ensure that it doesn't happen, but it happened, and so in that case, both the folks at the pharmacy and in the health system are dealing with it, and obviously we don't expect it to happen again. I'd say that particular circumstances is unlikely to happen again, because generally speaking, we're going to be delivering vaccine months in advance of any expiry date from now on.
I know I've asked something eerily similar to this before, but I'm working through, and this one's for a colleague at Global. First responders around vaccination. As you know, there's an anxiety building amongst first responders about hoping to get their vaccine. What do you say to them as they await resumption of the Astrazeneca/Janssen program, and what should they know about where they fit in all of this?
I've been talking to first responders quite a bit in the last few days with certainly leadership of people in fire, for example, and they know that they were slated to be up under the Astrazeneca campaign, and that was changed because there was a safety signal. So no one chose to do that, but we've responded, I think, appropriately and really quickly to pivot and to make sure we got that vaccine into people's arms. So that was all good. Sorry, I think. For everyone, there's just a battery issue, so I'll just give the core of that answer in a second.
No rush.
Sorry about that, Richard.
That's good, no rush.
You can hear the thing. It's not someone backing up in my office.
That died really quick. Wow. I was going in the scrap heap, I think. Just gonna power down for a second, everybody. Be right back.
You always go to the technology,
Okay, we're good to go again, guys.
Okay.
Sorry about that.
I've talked a lot to people in fire, obviously people in police in the last couple of days. I know their concern. We want to obviously get them immunized. No one could control what happened with the AstraZeneca. That's a safety signal that happened that we have to follow. It was a decision made by the National Advisory Committee on Immunization, and of course one that we follow. We're looking to target some Pfizer and Moderna at places where there are outbreaks, but that is a limited amount right now. The people who are most vulnerable are people who are clinically vulnerable or people who are our elders. And so we're asking people, and I know it's difficult, to be patient. They are high priority for us, first responders. We made that clear several weeks ago, and they continue to be high priorities.
This is from a colleague in the Okanagan, and you've hit on some of these, and I'll just let you explain it to her as well. She wants to know, is the province going to secure any more AstraZeneca? I should talk to her too. You can explain this during the answer. Considering right now it is only being given to one demographic, or is this pharmacy rollout a one-time blitz? And then what about the second dose on AstraZeneca for those that receive it?
So it's our expectation that we're going to get increasing supplies of vaccine in the coming months. The issue is now. Obviously, we want more vaccine. We'd like as much vaccine of all of the three kinds that we have available, and Johnson & Johnson. We'd like that vaccine as soon as possible. We received 68,000 doses of AstraZeneca in March. At the end of last week, we received a further 188,000 doses. We're expecting some additional doses this week. We referred to this shipment, I think, Richard, you'll remember, and people will remember, as the source and the manufacturers from South Korea. So that was a little bit deferred, but it didn't matter so much because we had the 188,000 come in the previous week. So we're expecting probably in the range of 48,000 more. And so there will be no issue with second doses. Obviously, a lot of work is also being done on second doses to see if there's interchangeability between the vaccines, and those clinical trials are happening, and that work is being done now. But there isn't going to be an issue with getting second doses of Astrazeneca to people 16 weeks from now. That's not going to be a problem. And I think there'll be a growing role for our pharmacy network, particularly in second doses, where I think we'll be leaning very heavily on our pharmacy network, and we're going to continue to lean on them. But right now, they've really stepped up and said, we're taking these well over 100,000 doses and getting them to people in this period, and we want vaccines in people's arms. And even if the targeted work groups that we wanted to see get the AstraZeneca, that wasn't possible, we want to see people get it.
A few school questions here quickly before we say
Okay.
goodbye.
Okay.
This is from Rebecca Lawrence. Victoria Teachers Association says more and more parents are taking their children out of school on their own accord, even though there's no official at-home learning program, creating extra work for teachers. What will it take for BC to allow or create a hybrid or online learning option for children? Is that idea even being considered still?
Well, remember, we have in every school extensive COVID safety plans in place, and we continue to make adjustments, and we made adjustments in recent weeks around those COVID safety plans to increase layers of protection, and we're going to continue to look at that. I think what we've seen and what we're living through now is the impact of a period when children were not in school, and so it's important to recognize when you're talking about children that over the period they are safer for all kinds of reasons, educational reasons and mental health reasons and COVID reasons. They are safer in the structure of a school during school time. So we're continuing to follow those COVID safety plans. Our approach of making sure that children went to school this year is still in place. And there's also significant leeway at the school district level to deal with circumstances in each school district. And I'm sure School District 61 is doing that just like all the others.
One of the things, and you know, we've heard the messaging around the safety plans, and we heard from Minister Whiteside that work's being done very closely with provincial health, and it seems to me, from the messaging from Dr. Henry, that keeping schools open are paramount. And I think people are starting to understand that, but many in school communities thinks that not having a learning option means that you, the province, is not hearing their anxieties or concerns. Are you hearing the concerns from them?
I can tell you that I think just had a light go off of this. There we go. I can tell you very simply that I hear from parents and from teachers and from education workers every single day, and we absolutely hear their concerns, and we're concerned. We want, it's absolutely vital that children get all that their education system can offer them, and it's been very challenging this year. And school districts have taken some different approaches to those issues. It's been somewhat different in School District 36 and in School District 39, and so on. So there's been some leeway for school boards within the guidance of public health to make decisions that make sense for their schools and their students, right? But I would say to parents that I hear from them every single day, and I hear from lots of other people every single day about COVID-19, and we always listen to people's anxieties and their fears. But I think Dr. Henry has tried to do is lay out the facts of what the circumstances are, or what the risks are, of the concerns we have, not just when children are in school, but when they're not in school, and a commitment to keep people safe. And I know it's difficult, and I so admire what teachers and parents have done this year, because in some places, not that different from here, around North America, we haven't had the school year we've had, and the impact on children in the long run of that will be significant as well. And this is not an achievement of Dr. Henry or anyone else. This is an achievement of teachers and administrators and education assistants and custodial staff and of course parents and the children themselves.
And we hear about that safety again and again, but we haven't seen transmission numbers within schools for a long time. So should we anticipate seeing some numbers soon around how many cases of COVID have been transmitted within BC schools?
Yes, and we'll be providing what you can expect on Thursday, and that would be part of that is an update to Dr. Henry's modeling, which we do regularly, and you'll be seeing an update to that this coming Thursday.
You know how much I love modeling. Thank you. Enjoy the rest of your Saturday.
Fantastic. I actually gave a short
wait,
answer at the end. Thank you, and yeah, and everybody be safe out there.
Wayne's gonna
Yeah.
just hold on.